Hello, I'm Joseph Sciabbarasi. I'm a medical doctor practicing in Los Angeles, and thank you for giving me this opportunity, Mayor and City Council, to speak. I must say I'm stunned by the information that you've just received. It's wholly disregarding the plethora of scientific studies done internationally on the dangers of mercury amalgam. An article published in the Los Angeles Times on June 2nd of 2002 says that dentists are the biggest mercury polluters. There was a reference study. The Journal of Dental Research, this is a conventional dental journal, gentlemen, ladies and gentlemen, says that intraoral air, which is the air that we inhale from our mercury fillings when we chew, passes directly into the lungs, and that it's a major source of chronic mercury exposure. These fillings are not stable. This is science. These are the published articles. Articles published from the Czech Republic have also shown that there's a strong association between mercury fillings and the possibility of autoimmune disease. If you look at other articles that have been published, and I want to bring this to your attention because you have to recognize that if you have mercury fillings in your mouth, every time you chew, you're releasing what's called metallic mercury, which passes easily into your lungs, which crosses easily into your brain, which is rapidly turned into ionic mercury, which is extremely toxic. If you compare the brains of animals fed mercury with the brains of patients who have Alzheimer's disease, they are essentially indistinguishable to an experienced pathologist. And what I'm saying is that this causes neurological damage. That's very well documented. The Federation of American Societies for Experimental Biology in 1995 said that at the very least, the traditional dental paradigm that amalgam mercury is a chemically stable tooth restorative material and that the release of mercury from this material is insignificant is wholly without foundation. This is the data. This is the published material that you can Google or look on PubMed for anytime you desire. These are not safe fillings. These are toxins. The American Dental Association, the American Medical Association, the American Nurses Association, and the American Academy of Pediatrics sued the Environmental Protection Agency in 2005, I believe, because of its failure to adequately protect children from mercury amalgams. The U.S. has called for a ban on mercury, or called for a treaty on mercury reduction. The United States government and the World Health Organization have requested a gradual removal of all mercury from global use. This is the data. This is not safe fillings. These are not safe things. I strongly encourage you to reject the proposition that mercury is a safe filling. The science doesn't support it. It's not toxic to humans. It's readily available to poison each of us. That's why I had my mercury fillings replaced years ago, and would ask you to please look at the science and not the conjecture. Look at the data and not the emotion. Please protect all of Long Beach from mercury amalgam. Thank you.